everyone, and welcome to our presentation. Our group would like to discuss the different education pathways to nursing careers. We'd like to begin with why are different education pathways to nursing important. As many of us are considering pursuing a career into nursing, and as we are applying to the BYU program, if we do not get in, hope is not lost. There are other options available to us if it doesn't work out. If finance is a factor on whether or not you'd like to become a nurse, I have some good news. If there are plenty of cheaper options for us to get our degree into nursing. And as we are going into nursing, there are plenty of opportunities associated with certain pathways. And for example, a variety of practices to choose from within each nursing programs. And it's up to us to do that research to find out what we would like to do. In our journey to become a nurse, we have the chance to decide on whether or not how much education we'd like to pursue. And each one of my classmates will go into a little more detail on what that entails.
The first couple of educational pathways to nursing careers that we're going to talk about are a certified nursing assistant and a licensed practical nurse. A certified nursing assistant works under the direction of a registered nurse and provides basic care to patients, such as helping them eat, bathe, and dress. To become a certified nursing assistant, you must complete the state-approved CNA training and clinical requirements, which can take approximately 4 to 12 weeks. And then you must pass a state certification exam. A licensed practical nurse works under the direction of a registered nurse as well as doctors. Licensed practical nurses administer more advanced basic care to patients, such as collecting samples, treating wounds, and administering medication. To become an LPN, you must complete the board-approved LPN training and clinical requirements, which can take approximately 1 year. And then you must pass the National Council licensure examination for practical nurses.
The next education pathway is the Associate's Degree in Nursing, also referred to as the ADN. This is a 2-year program, and 2 years is the shortest amount of time an individual can go through schooling to be eligible to take the NCLEX. The median hourly wage is about $27, and it can range anywhere from $20 to almost $40. Many hospitals do eventually require an ADN certified nurse to get a BSN within a certain amount of time of being hired. There are 2 other degrees, the AAS degree and the ASN degree, that are both 2-year programs. They're typically offered at vocational schools and hospital-based programs. And the AAS trains nursing students to learn the basics of nursing, and the ASN prepares students to take the NCLEX through hands-on training.
So if you decide to become a registered nurse or an RN, a way to obtain your license would be to earn your 4 to 5 year Bachelor's of Science in Nursing degree program and then take the NCLEX licensing exam. You can earn a bachelor's degree through a university's nursing program. Getting your BSN is the standard for an RN license, so there are some pros and cons to it. Some pros are increasing numbers of hospitals are only hiring nurses that have completed a BSN. The average salary of a BSN nurse is $83,000 a year compared to an ADN nurse of $69,000. BSN nurses are qualified to do more procedures and positions than other types of nurses like ADNs. Some cons are that the 4-year tuition for a BSN program typically costs about $72,000 to $104,000, plus fees and housing, which is more expensive than the other routes. They also take longer to complete than the other options, and it is difficult to get into with long wait lists.
Another option for those who are wanting to join and receive their nursing degree is to do the Air Force Nurse Enlisted Commissioning Program. What that is it pays for your tuition as you're going to school. And so you can choose whichever university you would like. And upon graduating their nursing program and passing the NCLEX, you just do 2 short trainings, the Commissioned Officer Training and Nursing Training Program. These trainings are focused in the military lifestyle, and it helps you have that experience that is very different from a civilian hospital. And so this is a great opportunity for those who are wanting to join the Air Force and also become a nurse.
Something I love about nursing is the graduate pathways that it has. This can include getting a Master's of Science in Nursing, which takes about 2 to 3 years and can help you be more specialized in a field of nursing that you really like, prepare you for administration, research, or being an educator. And those are some of the specialties that you can get with a Master's in Nursing. You can also get a PhD or a Doctorate of Nurse Practitioner. This takes a few more years. It's 3 to 4 years to complete. And the PhD is more research-based, whereas the DNP is more for the healthcare setting. Both of these are more geared towards leadership, though, and having leadership opportunities in the future. Thank you so much for watching, and we hope this helps you as you figure out what path is right for you.